Hi, I'm Dr. Greg Lewis, and I'm the Section Head of Heart Failure, Director of Cardiopulmonary Exercise Testing, and the Medical Director of the Cardiac Transplant Program here at Massachusetts General Hospital.
Hi, I'm Dr. Erin Colanisi, and I'm the Medical Director of the Mechanical Cardiac Support Program and the Fellowship Director of the Massachusetts General Hospital Advanced Heart Failure and Transplant Cardiology Fellowship Program.
Hi, I'm Dr. Lana Sau, and I am the Associate Medical Director of the Massachusetts General Hospital Cardiac Transplant Program and Director of Community Heart Failure. Together, we're co-directing the Harvard CME course Comprehensive Heart Failure Management in 2022. It is my pleasure to invite you to participate in this inaugural symposium that will take place virtually on Friday, September 16th and Saturday, September 17th, 2022. Heart failure is one of the biggest challenges to treat and requires a multifaceted, multidisciplinary team approach.
Harvard and the MGH Heart Center have partnered to provide an overarching course on the comprehensive approach to heart failure management. If you're an internist, cardiologist, advanced practitioner, or nurse caring for heart failure patients, or if you've ever taken care of a critically ill heart failure patient in need of mechanical support or cardiac transplantation, then this is the course for you. We'll feature world-renowned experts in the field of heart failure, interventional and structural cardiology, electrophysiology, pulmonary hypertension, and temporary and durable cardiac support, as well as cardiac transplantation. We'll plan to cover a rich breadth of topics.
The topics of the symposium are diverse. We will share unique insights into how to evaluate and manage heart failure. One approach to doing so will be through exercise hemodynamic evaluations to identify and refine heart failure phenotypes. We will focus on initiation and optimization of the 4 pillars of heart failure pharmacotherapy, as well as how to recognize and manage advanced heart failure. We will discuss state-of-the-art approaches to cardiogenic shock, left ventricular assist device support, and cardiac transplantation. We'll also address the role of comorbidities in heart failure, including diabetes, cardio-oncology, pregnancy, iron deficiency and its repletion, as well as adult congenital heart disease and more. This course also provides insight into the role of APPs and how to co-manage patients with our collaborators in the community. We will also address the importance of equity in delivery of care to our patients with heart failure.
From wherever you are in the world, please join us for a productive and fun learning experience on September 16th and 17th. You can find more information by following the link shown below or by Googling Harvard Heart Failure Management. This course offers 16.5 CME, MOC, and nursing credits. You'll have access to the on-demand course for up to 30 days. We hope to see you virtually at the course in September.